somebody is curious, Jessica, maybe, let's, what does moral era look like and maybe sound like for you as a hospitalist on nocturnal service? Let me try that one out. Let's start with that. What do you think moral era looks like from your job?
This is for me?
Yes.
Yeah.
Sorry.
Any other nocturnists on this call? What does the moral era look like as a hospitalist? You know, I see a bunch of comments that have come in on the chat that are asking about, the bigger team and the case management, the social work, all of the various players, the multidisciplinary team. And when you ask about the moral era as a hospitalist, to me, it's about the I think it's about the multidisciplinary team. It's about figuring out how to put all of the resources that we have in a really, really complex and opaque system, how to bring those resources to bear for every single patient. And one of the things that always blows my mind is when we have really particularly complex cases that have social dimensions or legal dimensions that are above and beyond the sort of average complexity, which, by the way, is, I think, higher than it used to be. I sit in a room, and I think we've talked about this before, Dad. I sit in a room with a social worker, a lawyer from the hospital's general counsel, with the nurse supervisor, with about 10 people. And those 10 people, we as a group can do to try to take care of the really complex situations always blows my mind. But we don't do that for every patient because we couldn't, because that's not feasible. So that, I think, is if we really listen to the patient and we combine that with a multidisciplinary kind of approach with all the resources we have, I think that's the moral era. I don't know what that looks like in practical terms, but it feels like that's at least part of the answer.